presentation will be given by Nanbi Kang on the incidence of permanent chemotherapy-induced alopecia among breast cancer patients. She's going to present a 5-year prospective cohort study. Thank you.
Thank you for the introduction. Today, I would like to present incidence of permanent chemotherapy-induced alopecia among breast cancer patients. Almost 80% of breast cancer patients should receive chemotherapy. The chemotherapy drug targets rapidly dividing cells, including hair follicles. As consequences, 40 to 100% of breast cancer patients experience complete alopecia during their treatment. And usually it recovers within 6 months after completion of chemotherapy. The chemotherapy-induced alopecia has a negative impact on patients' quality of life. Especially cancer patients seem to experience more difficulties with alopecia because of negative attitude toward cancer. As our previous research, we found breast cancer patients with distress due to alopecia were more likely to have poor body image and depression compared to patients without distress due to alopecia. While the chemotherapy-induced alopecia is considered as temporary, some patients still had persistent alopecia even some year after completion of chemotherapy. In fact, as a recently cross-section study, almost 50% of breast cancer patients who had completed chemotherapy more than 6 months before reported still had alopecia due to chemotherapy. Also, another previous study, we found long-term breast cancer survivors still reported higher level of hair loss and poor body image compared to similar age general population. While there is increasing attention in permanent chemotherapy-induced alopecia, there is little evidence regarding its incidence and impact. Therefore, we conducted a prospective cohort study to assess incidence of permanent chemotherapy-induced alopecia among breast cancer patients by qualifying changes of hair density and thickness. Therefore, we recruited breast cancer patients who diagnosed stage 1, 2, or 3 and are expected to receive chemotherapy. We measured the patient's hair condition prior to chemo, during chemo, and 1 month, 3 months, 6 months, and 3 years after completion of chemotherapy. Our primary outcome was incidence of permanent chemotherapy-induced alopecia, which was defined as an absent or an incomplete hair regrowth persisting 6 months after completion of chemotherapy. The incomplete hair regrowth was defined as either hair density or thickness were lower than 2 standard deviations compared to the mean before chemotherapy. To measure hair density and thickness, we use Foldscope. We also measure patient's body image and patient-reported hair problem using standardized questionnaire. Those were statistical methods which we used. Following is the result. We recruited 61 patients. The patient's mean age was 47. Among the participants, 52% of patients received taxane-based regimes. Patients' hair density decreased during chemotherapy and increased thereafter, returning to baseline levels at 6 months after completion of chemotherapy. However, hair thickness did not return to baseline level at 6 months, even 3 years after completion of chemotherapy. As consequences, the proportion of participants who had permanent alopecia was 39.5%. In addition, 42% of patients still have permanent alopecia at 3 years after completion of chemotherapy. Those results consistent with patient-reported outcome. At 3 years after completion of chemotherapy, 75% of patients complained their thinning hair, followed by hair volume, hair loss, and gray hair. And multivariable analysis to find the risk factor for permanent alopecia. Patients who had taxane-based treatment experienced higher incidence of permanent chemotherapy-induced alopecia compared to patients with other type of drugs. We also found patients who had permanent alopecia were more likely to have lower body image compared to patients without permanent alopecia. Those differences was 20 points, which was clinically meaningful score. Here is the summary of the study. At 6 months after completion of chemotherapy, 39.5% of breast cancer patients experienced permanent chemotherapy-induced alopecia. In addition, 42% of patients did not recover until 3 years after completion of chemotherapy. Patients who received a taxane-based regimen were more likely to experience permanent chemotherapy-induced alopecia compared to patients with other type of chemotherapy. Also, patients who had permanent alopecia were more likely to have fuller body image compared to patients without permanent alopecia. Here is the conclusion. Permanent alopecia is a common side effect of sequential breast cancer adjuvant chemotherapy, especially taxane treatments. Therefore, additional research is necessary to translate this finding and intervention for improving the distress due to permanent chemotherapy-induced alopecia in breast cancer patients after completion of chemotherapy. This study was supported by American Pacific and Universal Care. This is our study team. Thank you for listening.
Thank you for your very useful report. And are there any questions from the audience?
Thank you for your talk. Taxane is already well known to induce the permanent alopecia. In your result, the half of the patient received taxane-based chemotherapy. Therefore, how was the result if you classify the patient who received the taxane-based chemotherapy or without the taxane?
Oh, I already prepared the graph. Can you see the screen? Can I? This graph is certified with drugs. So you see the hair density did not big differences, but hair thickness more increase in the taxane group. So we think taxane makes patient hair thinner than before compared to another drug.
How about such a patient with the targeted therapy?
Targeted therapy did not differences in this study because I think the sample size is too small to detect the differences. But you can see these tables. We did analysis to find the risk factor for permanent chemotherapy-induced alopecia, but the targeted therapy did not choose effects on the incidence of permanent alopecia.
Inui from Osaka. So I don't have much experience of such kind of chemotherapy-induced alopecia. So therefore, I would like to ask you a question. So have you ever checked the correlation between the chemotherapy effect on the cancer itself and hair loss intensity? So, is there any correlation or other no correlation?
Correlation between what?
Anti-cancer effect
effect
of chemotherapy and hair loss intensity or severity.
We followed the patient, all patient survivor
Really?
yes. Our
It's very good.
patient survivor.
Thank you, Dr. Kang, for nice talk. So the permanent CIA is, according to the study, it actually is very high, it's 40%.
Yeah.
So, but clinically, we don't really see that high percent. So this because you take a photo microimaging.
No, we measured the patient's hair density and thickness using the machine, and then I think the definition of permanent chemotherapy alopecia, we included absolutely hair loss, and also we considered incomplete regrowth. So I think this makes the instance more higher than your results. But another cross-sectional study also defined patient hair incomplete regrowth, also included permanent alopecia. So we also included the definition of this.
Because I remember from Dr. Gongsan's studies in children it's about 15%, right? But in adults, 40% I think is really, really high.
Yeah, but this study also told, and him study using the pediatric patient, but this study using women, breast cancer women, so they had menopause and another aging and other effects to the hair decrease. But I think it's more than the aging effect, because this is in Korea study, you see the aging and then also decreased hair density and thickness, but the differences is choose in the patient with chemotherapy. So I think this is correlated with the population.
Okay, there is the WHO criteria to define permanent alopecia. Therefore, it's better to use such standard criteria rather than such arbitrary criteria.
I think in the breast cancer research, I use the references another the group and the Kruger. And in the permanent alopecia in breast cancer patient research, many studies use this criteria, so I will use, but I will check the WHO guidelines.
The criteria, the WHO criteria. Yeah, the results are very, very good. Depends on
Yeah.
what kind of criteria you use. Thank you.
I am a co-author of this presentation. So in this study, the most important thing was a decrease of thickness compared to a decrease in the number of hair follicles.
Thank you for the great discussion. Thank you very much.